Good day, and welcome to another episode of Living Well with Adina. We're glad you could join us. My name is Dr. Kataka, and I'll serve as your host today. We're grateful that you have taken time out of your day to find out more about COVID vaccinations and what we're doing to help the community. We want to let you know that we have joined partners across the state of Ohio in distributing vaccines, and you'll hear from our guests today all of the efforts that we're making to bring those vaccines out to you as quickly as possible. Although employees from school districts are now approved to receive the vaccination, Adina is not authorized to provide them at this time. But we do want to let you know of your different opportunities should you be listening in at this time. For those of you that are in the Chillicothe School District, your vaccinations will be managed by the Ross County Health District. All other Ross County schools will be work that are outside of Ross County in school districts. Please work with your administrator or contact your health department. We also want to add, from the bottom of our hearts, how grateful we are for all of you taking time to learn more about how to keep our youth safe and for doing the tremendous task of reaching out and providing education to them through some very challenging times. Again, we are very appreciative. We do want to hear from you, so if you have questions or concerns or thoughts, please enter them in below. We also want to let you know, for those of you that we want all of you to sign up for the vaccinations. We'll learn a little bit more here in the program about who and what ages are available at this time. But you can go on and you can see here the number. Call 740-542-SAFE to be able to put your name on a waiting list or to find out when you can receive your vaccine. You may also visit us at www.adina.org/COVID vaccine. I'll repeat these at the end of the program for you. So if you forget, we'll be able to remind you at that time. I do want to introduce at this time our two guests that we'll be talking with today. The first one is Dr. Kurt Tucker, who serves as our Chief Clinical Officer for Adina Health System, and also Fred Yingling, who serves as the Director of Pharmacy Services. Welcome, gentlemen.
Thank you, Dr. Tucker.
Yeah, we're glad that you're here. Dr. Tucker, we're into the third week now of working with the public. How's it going?
Very well so far. Fred and his team have done a great job setting up operations at the PACCAR Center, in which I believe to date we have been able to vaccinate around 1,300 members of our community very successfully. So 3 weeks we've been using the Pfizer vaccine, which means we'll begin giving people their second dose next week. So we'll start to have some return visitors to the PACCAR clinic.
Thanks, Dr. Tucker. Fred, he mentioned that you're at the PACCAR providing that. I've heard prior to the program, you're actually there today. Is that correct?
Yes. We're running one of our clinics today from 8 till about 5 o'clock.
Tell us about a little bit about how that's going. When folks come in, is it well received? Describe the atmosphere for us.
It's really been great. You know, I couldn't ask for better participation, and from the public that have come in. We've kind of set up. We've streamlined the process, as you know. The governor has outlined for us to make it a priority to take care of our oldest Ohioans first. So really trying to cut down on the walking, and it's counterclockwise where you come in, we screen you for temperature like we go through the regular COVID screenings, sit down, check in with your registration, get your shot, move on to another area where you're observed by our nursing and pharmacist staff there, and then we send you on your way. So it's been great. I think the community members, it's really been nice to see, because I really feel a lot of these people have been in their homes for this entire year, and they're able to get out and hearing the stories that they're really looking forward to be able to be more active and do more things and feel safe and protected. So it's really been great.
Now, Fred, we mentioned earlier in the program that it is by appointment only. And again, at the end of the program, we'll provide our audience with those numbers either to call or to go online. But once someone has the appointment and they arrive, about how long are they going to spend there in the total process?
Depending, we for the most part, when you come through, you sit right down to register. Sometimes there's a little bit of a wait or 5 minutes, but you'll take maybe 5 to 10 minutes of filling out the initial paperwork where we learn a little bit about your medical background and get your demographics, that type of thing. And the shot is real quick, less than 5 minutes. And then we ask that everyone sticks around, and we have an area for them to stick around to be observed for 15 to 30 minutes, because we know that, if there's going to be a reaction or some type of complication, it usually happens in those first 15 minutes. So really 45 minutes of the max, but really probably anywhere between, 20, 30 minutes typically.
Fred, have most people done well after they've received their vaccination?
Yeah, in addition to the public vaccination that we're doing, we started with our health system employees back in mid-November. And, there's some minor things, injection, site related in terms of some redness, but we haven't experienced any, anaphylaxis or anything needing further treatment. Of course, we do have EMS on site, and we do have, epinephrine and other drugs to quickly treat someone if something would arise. But so far, and I think that's pretty standard from what we've seen across the country, is the benefit definitely outweighs the risk of any type of adverse situations.
Dr. Tucker, you and I were talking a little bit a few weeks ago when you had the privilege of going over there and watching Fred and his team on that first day, and you described a really a great word. You described hope. Can you kind of take us back to that first day when you saw the first patients? What was that like?
Certainly, it was the very first day of the sort of the mass vaccination effort. Walking in and seeing the first candidates for this vaccine getting out of their cars. Of course, these folks, were 80 and over and making their way into the building. Some of them, it required a lot of effort and help from their family members. Come inside, to that environment of all the folks that are there, ready to give them the vaccine that could very well, prevent their premature death. And that's really what this is, even for folks 80 and over, is they don't have to die from coronavirus prematurely if we can get this vaccine into everybody quick enough. So, as I walked through and the excitement, the air kind of felt charged, especially the folks that were waiting their 15 minutes after having received the vaccine. I got to walk around and chat with some of them, and everybody was just in good spirits. And I remember, as I finished my tour there, feeling again that tremendous sense of hope that we were truly in the beginning of the end of this thing. This nightmare that we've all lived now for a year. Our anniversary's passed. That as we watch the numbers nationwide, in the state of Ohio, and even here locally, trending downward, and more people are getting the vaccine, this truly represents the beginning of the end of this nightmare for us all.
I think we all can use a little bit of hope. It's been a very long year, to your point, Dr. Tucker. Fred, each county is doing this a little differently. And for those who may not reside in Ross County, can you tell us a bit about where they can go for information? I believe the ODH has some information as well. Can you walk us through that?
Yeah, the Ohio Department of Health has kind of centralized all the providers, because they are the ones that are managing who actually can get access to give the vaccine. So the ODH website is probably your best place to go to see, as new providers come on, and some providers may not continue. We should see more community pharmacies, retail pharmacies, I know, in the coming weeks, that are proposed to be added to those lists, as well as, possibly, more health system sites or things like that. Also, county health departments, like in Ross County, our county is planning to set up a clinic at the Ohio University branch here in Chillicothe in coming weeks. So that's really the best place to go to get the most up-to-date information. As far as Adena, our website, our communications team has done a great job. There's a lot of information there, and you can go there and sign up for any clinics that we're having to get on our list.
Thank you, Fred. And when folks come in and they see your team and they receive that vaccination, they receive a card. Is that correct?
Yeah, we're provided cards when we receive the shipments, and it serves a variety of things. One being, if that's kind of your official record. What we do here is when you come in and you check in, we schedule your second shot, and we use that card to document that. It also says, let's say, things happen. Let's say you end up in Arizona, when it's time for your next shot and can't get back. Well, you have that. If you're at a provider there, they at least know, hey, they got Moderna or Pfizer or whatever. So hopefully to keep that continuity. So you'll get one of those shots, tells the product you got, where you got it, and then hopefully what your next doses do.
Okay, thank you very much, Fred. Dr. Tucker, we've heard in the news now there are new variants starting to develop. Tell us a little bit about what these variants mean. And does it mean there's going to be a significant impact going forward?
So nobody knows entirely. And what's happening is this particular kind of virus, there's different kinds of viruses. Some are DNA and some are RNA viruses. Humans, their body runs on DNA programming. This particular virus runs on something called RNA programming. And one of the interesting things about RNA is that it tends to be somewhat unstable. So these viruses love to mutate a lot. So much so that when the virus infects a cell in the body and then replicates, when that cell finally dies and those viruses come out of that cell to infect other cells, roughly 95% of those viruses cannot infect anything. That's how mutated they are. So, you can say, well, that's probably a good thing that they're useless. The problem is this lends itself to the virus being able to change its colors very quickly. The danger for humanity is that we've developed a vaccine, very effective series of vaccines now, for the sort of the original version of this virus. And what's happening when this virus infects whole continents on the planet is that virus is mutating as it makes its way through populations. We have two pretty much major variants right now. One is the UK variant, which, as everybody knows, is already making its way through most of the states in the Union. And then the other one, more concerningly, is the South African variant, which has called into question just how effective the current vaccines will be at preventing it. Now, these viruses don't mutate so much so that they remain completely novel. Remember, when we first saw this infection, they called it the novel coronavirus infection. Novel, I believe, is Latin for new, meaning our immune systems had never seen this thing before. And those types of viral infections are very dangerous because the immune system is not prepared when the virus invades your body. Most believe that even with these variants, the South African variant, that having had the vaccination will afford enough immunity that should you get infected, even with that more dangerous variant, that your risks of being hospitalized or dying from that infection are still reduced. So it's still very, very important for everybody to continue to get their names on lists, and when you meet the qualifications to get the vaccine, to really consider getting it.
So Fred, let's talk about the vaccines a little bit. We know that we have a Pfizer and a Moderna. You mentioned that the card. Is it important for folks to get the same, they're both two shots. Is it important for folks to get the same vaccine in the second dose? Yeah,
absolutely. You need to, you can't mix and match. Whatever you get the first shot, you need to get for the second shot. We do have a couple new products coming out, and really, we're really excited. The first one I think that's going to be available next is going to be from Johnson & Johnson, expecting it to get approved probably later this week or early next week. Great thing with that is it's one dose. So far, that could change. This is COVID-19, things change, but that's going to come out, and they've studied it as a one dose. So that's great. It just requires refrigeration. And then looks like AstraZeneca will bring the second product out. Looking like that will probably be early March before it becomes available. believe it's a 2-shot vaccine as well. So yeah, it's really important. It's something that we stress, and actually here, for example, with our clinic, the paperwork, depending on our supply at the time, we're color coding. So if Pfizer consents will be on white paper, Moderna will be on yellow. You know, we're trying to do things like that. We're just continuously educating, you know, our shot givers and that kind of thing. So as we go through this, it's a good thing that for supply we're going to have more products, but it does make it a little more complex and just, you know, a few more details that, you know, everyone needs to pay attention to.
So Fred, it sounds like we'll have 4, maybe even 5 different versions of a vaccine available within a couple of months.
Mm-hmm.
What would be your recommendation? Should folks wait to get a particular one, or should they get whichever one's available to them as quickly as possible?
I would say, you know, the evidence on these vaccines, as Dr. Tucker said, they're extremely effective. And the 3rd and 4th vaccines, they're showing great promise as well. So I would say the most important thing is get what you can get as soon as you can. You know, that's the quickest way. You know, as he mentioned with the variant strains, you know, the vaccines are going to help to some degree with the variant strains. So, and you know, it's long-term. We don't have long-term on this. So I don't think anyone could make an educated and say, this one's the best or this. They're all great. They all work really better than most vaccines that, you know, with efficacy that we're seeing. So that would be my recommendation is get something as soon as you can.
And review with us quickly, if you don't mind, the timing between the 1st and 2nd dose, at least for the 2 vaccines that are available right now.
Yeah, so the Pfizer vaccine, it is one that needs to be redosed after 21 days. Now, there is a little bit of wiggle room, you know, if, you know, that doesn't work out in terms of 3 or 4 days earlier, you know, and actually we found out now the latest evidence is that you have up until 6 weeks to be safe to know that when you get that 2nd shot, you're going to get the efficacy that they saw in the trials. But it's 21 days after the 1st shot for Pfizer. It's 28 days after the 1st shot for Moderna.
And your staff will help folks know when to come back. Is that correct?
Absolutely. And that's why at that first check-in, we are scheduling someone so we can write it on the card. So when they leave, they've got it in their hand. They don't need to make any more calls or, you know, get any more notices. They should have on their card, this is what I got on this date, and this is when I need to come in for shot 2.
Okay. Dr. Tucker, let's talk about shot 2. Folks have been reporting maybe a little bit more of a response in shot 2. And can you kind of tell us what you've been hearing with regard to how people feel after getting the vaccination?
Sure. So shot 1 seemed to go pretty good. There were a handful of folks around the health system. And again, here at just Adena, we've immunized over 2,000 caregivers, healthcare workers. And I heard of a couple of cases, some swollen lymph nodes in the shoulder on the side of the shot, some red arms, people experiencing tenderness in the shoulder where they got the shot, maybe some fever, chills. With the 2nd vaccine, we're seeing some more of that, indicating that the immune system is really recognizing that vaccine as being there and getting the body prepared to fight infection. So again, these symptoms are not reflective of us giving people coronavirus. These symptoms mean the immune system senses the presence of this vaccine, this foreign substance, and is going after it and preparing that should it return in the future, that it'll be ready to fight the battle really even before you get sick, which is really the concept of vaccines, is to sort of prime or prepare the immune system for a future exposure when you least expect it. So.
Is there anything a patient can do ahead of time to minimize those side effects?
They sure can, as long as you don't have liver, kidney problems, and generally your doctor says it's okay. Over-the-counter medication will work just fine. As a matter of fact, I took it sort of as a preventative. So the morning I got my second shot, I knew that some of them were feeling kind of achy and chills and having fevers. I thought, well, I really can't do that. I got to work for the rest of the week. So I started taking some over-the-counter Tylenol and some Motrin and just followed the instructions on the bottle. And I chose to take it for about 2 days after my morning vaccine. And I did just fine. I didn't have any of the bad sort of reactions or side effects, so to speak. So I was able to just work through the rest of the week. And I thought it worked okay. So again, you're going to want to make sure before you take 2 days of especially Motrin that you don't have kidney or heart problems, and certainly no history of ulcers in your stomach or intestines. If those things are all true, then you should be okay to take that for 2 days to prevent feeling poorly.
Thanks for that advice, Dr. Tucker. So Fred, let's talk a little bit about the staff that's with you there today. How many people are on site there helping to deliver the vaccinations?
Yeah, great question. We have, it's just a great testament to our, team at Adena in the health system overall. We have at least 16 people who are working either at one of the stations, and we have several of us from the medical group and pharmacy that are here kind of overrunning, filling in, doing other things as we can. But between our registration staff, our LPNs and our RNs who are giving shots, our pharmacists who are mixing the medications, and our nurses that are watching and observing the patients while they're here, it's 16, 17 people. And it's just, we have people from athletic training, our rehab departments, our urgent cares, our primary care clinics, retail pharmacists, hospital pharmacists. It's just been, we haven't had a ton of time to do this, but people came in, and we've had quality people that are helping with different things, and physicians are lending their the clinical decisions on some things. So yeah, it's just been a lot of people, but we're probably going to vaccinate around 400 people today. So it's we're lucky to have this great building here in the PACCAR Medical Education Center. It's really worked well. It's safe. Everything's on the ground floor, except, especially for, our older community members. So great parking. So, yeah, there's probably 20 people here in all.
So, Fred, you mentioned a statistic to me prior to the show starting about the number of people who've been vaccinated versus the number of people who have contracted COVID. And there's a little bit of hope there. Can you kind of tell the audience what you were mentioning to me earlier?
Yeah, as Dr. Tucker said, one thing with this vaccine was you really saw hope. You felt like, man, there's light in a tunnel. But, this week, and I think for Ohio and across the country, we've now surpassed, we've vaccinated or protected more people than have gotten COVID. So our numbers of vaccinated outweighs the number of people who've tested positive for COVID. So, we've kind of caught up, in a month and a half, we've caught up to this year long, struggle we've been in of all the horror, and it's been horrible, the spread, and the length of time. And so, I think that's a great thing. We're doing our best. This is not our, we're still taking care of you if you fall on the ice and break your leg, or, forbid have a heart attack, or we're still doing that, but we're also doing this. And, everyone across the country that's been able to deliver this, it's really great. But those are that's the real numbers. We've caught up to the COVID positive patients in a month and a half of vaccination. So, you'd like to think hopefully it's really a lot of greener pastures ahead.
Yeah, and hopefully with the addition of a new vaccines, we can get even more and more people vaccinated along the way. As a reminder, for those who want, we encourage everyone, right? So please call 740-542-SAFE to register and be put on a waiting list. or again, you can go to www.adina.org/COVID vaccine. Here in a few more minutes, the few minutes that's remaining, Fred, tell us how your staff manages the vaccine. I mean, does it just come to you in the mail and a staff goes down and picks it up? I mean, we've heard a lot of. Tell us about the special handling that you folks have to do.
Yeah, I mean, it's really, a challenge with this is, it kind of does. The Moderna comes to us frozen, and then we're able to just transfer that to, standard freezer. And then there's, we can transfer that to a refrigerator when we get closer to time. And then, obviously there's a warming up period before we give it. Pfizer comes, and some of these come from UPS, FedEx, some it's special delivery. And, I'm kind of on call 24/7. I get a call, hey, I'm 25 minutes and I have your Pfizer vaccine, and, meet me at the dock type of thing. But the Pfizer comes already packaged, packed in dry ice, which it's good. Should be good for 5 days if all that is correct. And we can transfer that onto a refrigerator from them, and, to extend the shelf life. And then, of course, we need to take that out and warm it up before we mix it up. The Pfizer actually is something that we have to, kind of mix up, add some saline to it to put it from powder to liquid form, so we can draw it up for the shots for nursing. Moderna is a liquid. So it differs with the product. It depends whether, first shot or second shot. We get some deliveries early in the week. We get some deliveries late in the week. So it's really kept us on our toes in terms of keeping track of it.
Lots of logistics there, Fred. We do have a question coming in from a viewer. Does the second shot contain the same ingredients as the first shot?
Yeah, that's a great question. Yes, exactly the same. It's just, you need that second shot to kind of reintroduce to your body so that it gets that, charge. And so, your immune system knows what that is, and it's ready for, the real thing comes along. So, yeah, the first and second shots are exactly the same.
Dr. Tucker, sorry, go ahead, Fred.
But the different companies are not the same.
Gotcha. Dr. Tucker, another question from a viewer. Do you have to wear a mask after receiving your vaccination?
Oh, excellent. Yes. At this point in time, nobody knows for a fact that after you've been vaccinated and are protected against symptomatic infection, does that still mean that you can't be exposed and transmit the virus to somebody who's not been vaccinated? So we don't know the answer to that yet. They are actively looking at this right now. And the outcome so far suggests that, yes, that once vaccinated, your likelihood of transmitting goes way down. So unfortunately, until we know that answer with a greater degree of certainty, yes, even after you're vaccinated, you should continue to practice everything we've all gotten used to over the last year, which is wearing our mask when we leave our house, not gathering indoors with a lot of people, washing our hands, and trying to stay out of crowds, so social distancing.
Next week, who's available for the vaccinations, Dr. Tucker?
These vaccines were started in a step-down priority fashion. This was dictated by the state of Ohio and the Department of Health. We started at folks 80 and over, and each week have been moving down by 5 years. So this is our week of vaccinating folks that are 70 and over, and I believe next week we'll start in those folks that are 65 and over. So the way that we've been trying to schedule these, because we're not getting a whole lot of vaccine just yet, is that when you get on our website and put in your information, your email and your contact information, we know obviously how old you are, and then you go onto the list. So first come, first serve as far as sign up. When we get enough vaccine that we can put you into our schedule, confirm that we can give you the shot, we will reach out to you, call you, and give you your date and time to show up at PACCAR and be vaccinated. And it's at that time that we schedule you for your follow-up shot, and we start filling out that card that you guys showed everybody for the permanent record. When that's all done, and we submit that information to the State Department of Health for statewide record keeping. The big unknown right now is at what point in time the state will release us to vaccinate those that are younger than 65. So to date, the only two groups that have really had that privilege are healthcare workers, which obviously we've worked our way through, and then this week, school teachers. So we don't know a lot going forward about the timeline for those that are not healthcare workers or school teachers younger than 65. But as soon as we do, we will be putting that information out there.
And Fred, for those who are on our waiting list but have not been contacted by ADINA, again, there are other options, I believe, with the Ohio Department of Health, correct, that they could explore.
Yes. The Ohio Department of Health lists all the vaccine locations by county. So, and then I'll have their contact information. Most everyone has a list that they're running. As Dr. Tucker said, no vaccine provider has received more vaccine than they have demand for. So it's perfectly acceptable if you want to sign up on all lists and go with whoever contacts you first. It would be great if you contacted the other ones and said, take me off the list, but we understand that. But yeah, I mean, that's pretty much everyone it has to follow the list program so they can get their schedules full.
Well, thank you very much. Well, we've concluded our program here. We're grateful for the two of you. At the end here, Dr. Tucker, any final words that you'd like to share with our audience?
I think just the importance of keeping, an open mind. I certainly understand that getting a vaccine can be a very scary thing. People are worried legitimately about some things. They don't want to get this and get sick. Some of the things are a little, different, that it'll change your DNA or anything like that. So skepticism is healthy, but in the end, come to things like this, ask people who know, go to internet locations that have, reputable information. The CDC is a great one. It's what we all go by. And these are career folks, scientists and physicians and pharmacists that this is what they do every day. Nobody would ever want to recommend something to hurt so many people, such as, a vaccine if it didn't work or if it was dangerous. I've elected to get this vaccine myself. My whole family, when they reach their point in time of being eligible, will be getting this vaccine. My mother and father will be getting this vaccine. And at this point, just making sure you keep an open mind. Nobody wants to force anybody to do anything. We would like, through open discussion and discussion of facts, have people be willing to take this vaccine, which certainly will protect them, but more importantly, also continue to protect others that haven't yet had the opportunity to be vaccinated.
I want to take this time to thank you, Dr. Tucker, who serves as our Chief Clinical Officer for ADINA Health System, for joining us once again today and providing us this valuable information. And also a heartfelt thanks to you, Fred Yingling, who's the Director of our pharmacy at ADINA Health System, and particularly to your staff and for the time and dedication and service that they're providing to get our friends and neighbors and loved ones all vaccinated. The work that you two do is great and will help us to continue to build on that hope that we described earlier in this program. Looking at my notes here, I do want to make the audience aware that we want you to invite you also to listen into other ADINA programming. We have a radio show called Lady Parts with Dr. Richard Villarreal, who will be discussing all things women's health. The next Lady Parts show will also discuss COVID-19 vaccinations and will air on February 15th at 10 a.m. on WKKJ 94.3 FM. So again, that's February 15th, 10 a.m. on 94.3. Also, we would like to invite you back again for another edition of Living Well with ADINA, which will be on February 18th at noon. Please get vaccinated, stay safe, and thank you very much.